This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, joining me as often is the case is one of the experts we call in from time to time to help us understand the complexity of health care is Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Healthcare Association. I think I got that right. Complexity, right? You live in a very complex world. I don't know how you understand and follow it. It's really very complicated, isn't it, Doctor?
It is very complicated, and one of the nice things about coming on here is I can talk with you about facts.
Yeah, well, that's important.
I'm not a Republican. I'm not a Democrat.
That's exactly
I'm like
right.
an umpire who calls balls and strikes as I see them.
Yeah.
And that's what I'll do today.
I want to talk about the budget for, in the state healthcare budget, and a little bit about Medicaid expansion still up in the air. But before I get into that, I think this is pretty important. We are buffeted now with a series of stories about the implementation of the Affordable Care Act. Where do you think that stands in 2 or 3 minutes, and then we'll get on to the other? It's an important subject, I think, for our viewers.
Great. The governor is facing a lot of pressure to say, I want to expand under Medicaid.
Right.
But let's look at the facts. Today, Pennsylvania spends more than 48% of 48 other states on Medicaid as a percentage of their state budget. The governor has asked the federal government 4 simple questions. And again, I'm not for it or against it. I'm for looking at the facts. He said, how much will you pay federal government if we expand it? He said, for how long will you pay that? He has said, under what conditions will you pay that? And then he has said, what flexibility will you give us? He hasn't gotten answers to those questions. So he is a little bit like Sidney Crosby as he plays in the Ottawa Penguins series. He doesn't rush to where the puck is today.
Right.
He's looking ahead 2 years, 3 years, 4 years of where the puck's going to be or where the financial state of the state's going to be. And he is being very clear. Answer some questions, and then we can have a dialogue. Yeah. But he's not reacting emotionally. If he were to expand Medicaid today, the implications are that 1 in 4 Pennsylvanians will be on Medicaid for their health care. And he's asking, is that sustainable? Mm-hmm. Now, he's putting all the emotion aside. He's saying, what can we afford? Where this is going to end up, I don't know, but I don't think we ought to rush to a judgment that he's anything but thoughtful.
Yeah. I mean, one of the other things that sort of puzzles me, and like I'm a neutral in this, I have great healthcare coverage, I won't be affected by this, but we obviously care about patients and care. Here's another question for you. Can we afford the Affordable Care Act given these circumstances? I've always wondered if the young folks who are supposed to buy coverage or pay a penalty and pay for the rest of the folks, particularly older folks who are sick who will get provided, is that a sustainable model, knowing the young immortals are not likely to buy coverage or pay the fine some way, somehow? Well, do you think that's a sustainable model?
I'm not sure the model is sustainable, but I do know that if Medicaid is expanded and it is not financially sound, and I'm not sure it can be, that services to the elderly and the disabled who need real services today, there's going to be wait list. Because the pot is only so big here in the state.
Right.
We can't print money like the federal government can. We can't run a deficit like the federal government. And if, without real assurances and dollars from the federal government, Medicaid is expanded under the Affordable Care Act, it will take dollars from the frail elderly, from the disabled, and from kids. So that's why this analysis needs to be looked at very carefully and not emotionally. And that, I think, is what the governor's trying to say to people who are saying, move on quickly. Mm-hmm. He's saying, let's approach this thoughtfully.
Yeah. Okay. We're going to run to a break. When I come back, let's talk a little bit more about the healthcare budget in the state. It's consuming more and more. What's 24%? I heard figures like 27% of the state budget. I will say this. I noticed that healthcare costs only went up in general 3%, 3.5%. There's not rising these about twice that over the years. I don't know in your nursing homes whether that's true or not. But overall, it looks like the impact of healthcare, I don't know what that'll have to do with the budgets, you know, whether that makes them more sustainable or not. That's something I'm sure, that's why I'm asking you.
Well, let's look at the state budget. Do we have to, the legislature has to pass the budget over the next 45 days, more or less. And there's a lot of challenges. And as you know, I like to talk about the elderly and the disabled.
Right.
And most of your viewers have a simple concern, which actually was told to me by a Swatera cop the other day. He said, I don't understand all the budgets. He says, my mother's on Medicaid, but the real question is if she falls and breaks her hip, which a friend of another cop's father did, where's she going to get the care after the hip is repaired? And is she going to be able to find a nursing home where she's going to need to go, where she can get care near her house that's of good quality? And it's interesting, the state budget addresses that question. And for the first time in several years, a governor in his proposed budget said, let's put a little bit more priority onto the frail elderly. And the governor did that by putting in a small budget increase. And he said, that's a priority. And that, in fact, is something that I hope the legislature continues. Now, there's all sorts of debates of, well, where dollars should go. Should it go towards transportation? Should it go towards horses? Should it go towards education? And the legislature is also looking at some other things. They're looking at, should the frail elderly be able to find access to a nursing home that's close to home? And should they have to stay in a hospital longer than is necessary before they go to a nursing home? So it's the elderly who I tend to work with, and as I call balls and strikes, is a real priority this year. And I'm hopeful that despite what the money that's spent on Medicaid, and you said earlier how much is spent, Pennsylvania spends close to 35% of the state budget,
total state
budget on a variety of Medicaid programs. Many of those, by the way, not mandated by the federal government, which is part of the problem under Obamacare, is that our benefits are real great today, and the governor has said, can I cut some of them back? But the frail elderly needs to remain a priority. Governor has wanted to do that, and the real question is, will the legislature support that?
Yeah. Go ahead. On a related topic, you know, I've been into a lot of nursing homes in the last couple of months doing talks. You know, they have, and one of the things that really impresses me, and we're off the subject, but I'm the host, I'm allowed to do this, is every time I go in there, I would think, oh, this is a little scary for people. They come out of their homes, they go, these people love it. I mean, by and large, every place I go, I talk to them about it, they really enjoy it. They're a little fearful, I think, you know, oh, I'm leaving my home, I got to go into a nursing home. I'm amazed at how many people get in there, and they really enjoy the camaraderie. They enjoy the, you know, getting together with their peers. It's amazing.
It's a new home with care being provided that's very secure. The food is pretty good. But
and healthy.
Most of all, the health care is really good. No one goes into a nursing home if they don't need 24/7 care. And it's really important that we continue to make them a priority in this state. And that's why I get up every morning. That's why I come to work every day, is to make sure those folks get their care.
And we have, as we've talked about before, I mean, look at you know, 75 million of us who, baby boomers, are reaching that stage. In some cases you can stay in your home, in some cases you can't. Why that part of what we do, and particularly in Pennsylvania, is so important. Third largest senior citizen population in the country, and why the health of nursing homes is I think, a pretty important area of state government to be concerned about. You get the last word.
It's a pleasure being here, and let's remember George Leader, who just died, former governor.
As we tape this, as it airs around the state, George Leader's funeral will have been on a Thursday. Go ahead.
And he, you know, he was governor very young.
Yep.
He's been over 50 years since he was governor. Yep. And all those 50 years, he devoted himself to the elderly.
Yep, that's
true.
To
building programs. And so let's mourn him well.